Look at your Health Watch. November is American Diabetes Month. Type 2 is the most common, making up 90 to 95% of all cases, and that number is going up. So joining us now is Dr. Lindsey Fish from Denver Health. Thank you for being here as always. We appreciate you, Dr. Fish.
My pleasure.
Appreciate you. So why are more people getting diabetes, and who is most at risk? Talk to us about that.
Yeah, so as you mentioned, rates are really going up. We're seeing increases of nearly 40 million now Americans having diabetes, with tripling in the last 40 years of cases. And the real reason is because of lifestyle changes. Unfortunately, type 2 diabetes, which is the acquired kind, is very common, and it is a result of excess weight, lack of exercise, and not nutritious diet predominantly. There are genetic factors too that contribute, so we see higher rates in non-Hispanic Black, American Indian, and Native Alaskan populations as well compared to white people. We see higher rates in older patients. And then the other big factor is really social factors. So unfortunately, people who are struggling financially don't have access to good, healthy food, or don't have a regular supply of good food, need safe spaces to exercise outside, which isn't always the case, and good access to medical care, which isn't true for everybody too. So lots of factors contributing to why we're seeing this increase.
Yeah, absolutely. And let's talk about early detection too. How can early detection and prevention change that outcome? It can change the outcome for patients.
It can, and it really is so important. I mean, the first thing, as you mentioned, that is 1 in 4 people who have diabetes don't even know they have diabetes. So you have it and you don't even know it. And we've got great tests now, not only for diabetes, but to diagnose pre-diabetes. So before you actually have diabetes, we can diagnose that and start to intervene right away. The interventions are really weight loss and exercise, but we know that implementing those things reduces the risk by over 50% of getting diabetes. And the secret to success is really support for making that happen.
Yeah, and I feel like weight loss, they always tell you that helps with everything, right? And having a healthy diet. I mean, that's beneficial all around.
I say it all the time, almost every week. I'm saying eat well, exercise. All those things are just really so important.
Yeah, it's true. So let's talk about the personal and societal impacts of diabetes. Talk to us about that.
Yeah, so if you have diabetes, you're just at huge risk for other complications. We see higher rates of heart disease, stroke, kidney disease, and blindness. And unfortunately, managing diabetes is really tough and stressful. So those patients also struggle with more depression and anxiety. Society, it's really expensive to have diabetes. So people with diabetes spend over 2.5 times more on medical care than those without it. 1 in 5 healthcare dollars goes to diabetes care altogether. And again, as I mentioned, a lot of those costs fall on people with lower incomes. And so it's really making health disparities worse.
Yeah, and people can protect themselves out there. They're watching this, they want to protect themselves and make a difference in the fight against diabetes. How do they do that?
So for each individual, get checked. We recommend screening starting at 35 or even younger if you have any risk factors. We talk about it, I'll say it again. Let's get our 30 minutes of daily exercise, and let's choose healthy, fresh, nutritious foods, as opposed to the sugary stuff, especially this week after Halloween with so much candy around in all of the workplaces. We're seeing it. So really important that. And then the last thing is support each other. So community events, support your friends and family, and go from there.
And every bit helps, right? Even just walking up the stairs or taking a walk on your lunch break, right? Everything helps.
We don't even realize we spend so much of our day just sitting. Most of the time, we're not outside enjoying the beautiful Denver environment. We need to enjoy and take advantage of what we have.
Yeah, you're absolutely right. Dr. Fish, thank you so much. We appreciate your insight as always. We're going to see you next week.